All right. Okay. All right. So, good evening, good morning, good afternoon, wherever you may be connecting from, because we have people connecting from different parts of the world. Currently on the call, we have people connecting from Asia, Japan in particular. We have like two. We have people connecting from the United Kingdom. Hopefully, we are going to have more people from other parts of uh, the world connecting to this virtual training series. Okay, so my name is Dr. Chima Emmanuel Edoga. I am uh, a new fellow or a recent fellow from the Nigerian Postgraduate Medical College of Nigeria, Faculty of Ophthalmology. I'm also a fellow of the International Council of Ophthalmology, FICO, and the founder of the Nigeria Collaborative Research Network. So we have a package for us this time, and we are going to just allow some of us to make quick introduction. All right, so the secretary is supposed to do the introductions, but she's not around. So I'm going to call on someone who is a part of the network to do the introduction. So Dr. Boma, please, do you have a good network so that you can help us? Dr. Boma? All right. Dr. Boma seems to be having, okay. She said that she doesn't have a good network. All right. Okay, so I will ask some other person to join. Dr. Linda Chizoba, you have a good network so that you could help um, moderate this session of this training lecture. So we just want to anchor the introductions of those that are on the call at the moment. So if your network is good, please just indicate.
Yeah, good evening, Dr. Edoga.
Good
Good
evening.
evening, everyone. I don't know if I'm audible.
Yes, we can hear you.
Mm, okay, thank you so much for calling on me to moderate this section of introduction. So on my list here, I'll start with Dr. Rohan. May we meet you, please, sir?
Hello, nice to meet you.
Yeah, so just maybe say your
Want to
name,
know,
say your
yeah, your
affiliation
name.
quickly, which state or country you are from, just in about 10 to 15 seconds. All right, thank you.
Yeah, thank you very much for this opportunity. So I work as a researcher at We Inc., which is the organization, and I'm also affiliated with an eye clinic in Japan. It's called the KI Yokohama Eye Clinic, and yeah, thank you very much for having here. I appreciate it.
Thank
Thank you
you.
so much, sir. Thank you. So I'm seeing Esther. Please, we'd like to know you more. Your name, where you're from, your affiliations. Hello.
You talked about Esther Ekwe, right?
Yes.
Okay, Esther Ekwe, please just briefly introduce yourself, man.
Okay. My name is Dr. Esther Ikwe. I'm actually a consultant cardiologist, but I guess issues of the eyes concerns everybody. I mean, need our eyes to be able to do whatever we want to do. That's why I actually tuned into this. That's equally important. So, like Dr. Chima had told you earlier, I'm the current chairman of the Nigeria Medical Association, Enugu State Branch. So So I'm not just here to gain knowledge for myself. I'm also here in solidarity for my valued Dr. Chima Edoga. I'm here to
Thank,
protect him.
thank you very much, ma. We are
So
very
much, ma.
grateful.
To have you on board, ma. Thank you, ma.
You're welcome. Thank you.
So, Alpha Christian.
Okay. Good evening, all.
Good evening,
Uh,
sir.
I'm Dr. Akpa Christian Obasi. I'm a public health physician in Abakaliki, Ebonyi State, Nigeria. So, the issue of eyes, like the previous person just talked about, is basically a public health issue. So, and I've keyed into this movement to tap knowledge, to learn more, and to build career. And also, Dr. Chima happens to be my very close friend and classmate. So we've known each other for many years. So we are here to also support his vision and tap from this movement. Thank you for the opportunity.
Okay.
Thank
Thank
you,
you
sir.
so much, sir. So, move to Dr. Anebe Atta. Anebe Atta.
Hello.
Yeah, we can hear you, sir.
Okay, so I'm Dr. Anibiata. A consultant ophthalmologist. And I'm a part of the Nigerian Collaborative Research Eye Network. Thank you very much.
You're welcome, sir. Thank you, sir. Dr. Boma Ogo Oribo. Please, we'd love to meet you.
Um, Good afternoon. Sorry I couldn't answer this. Not stable and I'm not settled. I'm Buma Abufuribo. I'm an ophthalmologist at National Hospital Abuja and a member of the NICA network. I'm glad to be here. Thank you.
Thank you so much, ma. We're really grateful. Dr. Chidi Mbatigwe.
Yeah, good evening, everyone. I'm Dr. Chidimba Kigwe, a consultant ophthalmologist and a medical retina specialist. My affiliation is with ASU Teaching Hospital, Berkeley, Enugu. Thank you, everyone.
Thank you
I will
so much.
also add that he is one of my supervisors for my part 2 dissertation. You're welcome, sir.
Thank you,
You're welcome.
Chima.
Dr. Chiwendu Juliet. I'd like to meet you, please. Are you with us? Dr. Chiwendu Juliet.
Okay, just move to the next person, please.
Okay, Dr. Cyril Obatuyi.
Okay, Dr. Siri just left the meeting. You can go ahead.
Okay, Dr. Isuke Timizu.
I think this is from Japan. So
Yeah.
please, yeah.
Okay. Hello, doctors. My name is Dr. Shimizu from Wing University. So I'm working with Dr. Rohan in Wing. I'm the ophthalmologist, and yeah, we are presenting the smartphone device called Smart Eye Camera, which can utilize the smartphone function to the conventional microscopes, fundus cameras, and etc. We're trying to we're very happy to connect to you today. Thank you.
Thank you, sir.
Thank you
You're
very
welcome.
much.
I would also like
Doc-
to add that Dr. Aske is the founder and CEO, and he's also the creator of all of this. And my
Right.
supervisor too, of course.
Thank
You're
you.
welcome.
Thank you.
Dr. Awuwa Bata.
Okay. Good evening, all. The name is Hawa Bata. a consultant ophthalmologist with the Federal Medical Center as a Bauchi State, also a part of the NESA network. Thank you and for having me. I'm happy to be here.
You're welcome,
You're welcome,
ma.
ma.
Dr. Prayer Harry. Are you with us?
Prayer. Okay, I think she just left the meeting. Please go
All right.
ahead.
Dr. Modupe Adebayo.
Good evening, everyone. I'm Modupe Adebayo, a fellow ophthalmologist with University University Teaching Hospital, Oshogbo. I'm glad to be here. I'm a member of NISA Network. Thank you.
You're welcome, ma. Thank you, ma. Dr. Nkiruka Okolago. Okolago.
Good evening, everyone.
Good
My
evening,
name
ma.
is Dr. Nkiruka Okolago. I'm a consultant ophthalmologist. I'm also the head of departments of ESU Teaching Hospital, Parkland, Enugu. I'm one of the advisors for NISA Network. I'm happy to meet you all today.
Thank you so much, ma.
Thank you, ma. Before we continue, I would like to say that she is my HOD, and I'm glad to have her on. Because of time, I'm going to allow 3 of our senior advisors who are on the call to quickly introduce themselves. Please, Professor Adebayo Adio, please go ahead, ma. Ma, we can hardly hear you, ma. We're having difficulty hearing you. Okay, we can hear you now.
Okay, I'm Professor Adedayo Adio. I'm a pediatric ophthalmologist. I'm based in the south of Nigeria in Port Harcourt, and I'm very happy to be here. I'm one of the advisors, and I congratulate you all. This is a landmark meeting. I wish you all great success and collaboration. Congratulations.
Thank you so much, ma. Okay, I want to call Dr. Gugua Okonkwo to please introduce himself. Thank you, sir.
Hello, can you hear me?
Yes, we can hear you, sir.
Okay, so my names are Ogugua Ndubisi Okonkwo, and I'm a consultant vitreoretinal surgeon, and I work at the Eye Foundation Hospital. So I've been invited to be an advisor to the collaboration that you have, which I think it's the first of its kind. So to start something, I always tell Chima, to start something is not too difficult, but the important thing is to continue it and to grow it. So I'm looking forward to the fact that I will help to advise and to grow your collaboration. So I'm happy to be here. And at a short notice, I had to give up everything I was doing to come here because I feel it's important to mentor the younger generation. So you are all very well encouraged, not only to be part of it, but to call and bring in others, even younger ones, the residents. They need to know about research. And I think that this is a good opportunity to train and to not just train, but to practicalize research. So thank you very much.
Thank you so much, sir. And last on the list currently is Professor Onochi Okoye. Please, sir, you can let us know more about you, sir.
Thank you very much. Are you hearing me?
We can hear you, sir.
Okay, thank you. And I apologize for joining a bit late. As I had earlier explained to Dr. Chima, I'm actually engaged in another function, but because of the importance of this meeting, I've decided to disengage myself from the other event to be here. For me, I count it as a big privilege to be associated with this initiative. What we're having here today for me is a very significant milestone in our collective journey to advance research, particularly with respect to eye care and vision. And I know we have a collection of brilliant minds who are passionate about improving sight and then improving the lives of our people, particularly in Nigeria and Africa. So I look forward to being an active advisor and member. I look forward to the collaboration, the knowledge we're going to be sharing. I look forward to the opportunity to develop innovative solutions tailored to our needs in Nigeria, particularly. I look forward to helping us build capacity and then to mentor the younger ones. In fact, mentoring actually should be bi-directional. As we mentor the younger ones should also mentor us too, in some way, because nobody has monopoly of knowledge. So it's a worthwhile venture. I believe all of us should do all we can to support this initiative. I may not be staying till the end of the meeting because, as I told you earlier on, I'm also engaged in another event, but I'll try as much as possible to stay for as long as I can. Thank you very much.
Thank you, sir. Dr. Linda, please, you can go ahead quickly so that we can, I'll quickly make the introduction and invite the second speaker. Thank you.
You're welcome. Dr. Nnamdi Ene. We'd like to know you.
Good afternoon, everybody. My name is Dr. Nnamdi Ene. I'm a senior registrar at the National Eye Center, Northwest Nigeria, and I'm happy to be part of this network. Thank you.
You're welcome,
Thank you, sir.
Dr. Nora Otapilot. Are you with us? Okay, Dr. Nurat Adeleye.
Hello, good afternoon.
Good afternoon, ma'am.
Very senior colleagues and colleagues. Very happy to hear their voices being part of us. I'm Nurat Adeleye. I'm a fellow at Asokoro District Hospital, Abuja. Thank you.
You're welcome, ma'am.
Okoro.
Good afternoon. My name is Okoro Uchenna. I'm an ophthalmology public health physician. I was an international fellow at Moffitt, UK, and international fellow in University Medical Center in the Netherlands, and presently at David Umahi Teaching Hospital in University.
Sorry, we didn't get your last point. Your audio was a bit low.
Okay, I said I'm Okoro Uchenna Okoro, that I'm an ophthalmologist, public health physician at David Umahi Teaching Hospital.
Okay.
I was a fellow of the ICU at Moorfields, UK, and a fellow of ICU at University Medical Center, Utrecht, the Netherlands.
You are highly welcome, sir.
You're welcome, sir. Dr. Oluchi Ndidi. Okay, Dr. Onyinye Onya. Hello?
Okay. Dr. Onyinye seems to be having issues with network. All right.
Dr. Tiwalade Adeaga.
Good afternoon, everyone. So, Alade Adiaga, ophthalmologist at Ira Specialist Teaching Hospital. Nice to have you on board. Thank you.
Thank you,
Welcome,
sir.
sir. Dr. Ugochukwueze.
Good evening, all. My name is Gutkweze, an ophthalmologist at Paramedical Center, Nigeria. Thank you.
All right. I think we're going to end the first session of introductions. Maybe later we'll pick it up. So I want to once again appreciate everyone that is on this call. Currently, we are about 40 on the call, so I'm very grateful. We hope that more people will join us. So the NISA network is a collaboration of ophthalmologists and other health professionals that was formed sometime in last week of April. So we are just about 2 months old. It's the Nigeria Collaborative Eye Research Network. We have core objectives. I'm just going to share my screen briefly because of time. I'm going to share my my screen because of time. Okay, if you can see the screen. All right, so this the screen that I'm sharing is actually from our website. So we have training, 2 core objectives in training and 3 core objectives in research and in grantsmanship. So we have, for training, we have to build the capacity, career advancement opportunities, and scholarly output for the members in the network through quality ophthalmic research, and also to build the capacity of members in grantsmanship. So training is a core objective of this network, and we outlined a series of trainings for us to go through between the 1st of June and the last week of August. So we have 3 months training lined up. So you can see it on our website at www.nisanetwork.org/training. For the research, the core objectives are to conduct quality, collaborative, ophthalmic research on various thematic areas on state, regional, and national levels. Then number 2 is to provide eye-related data for practice and for policy making for stakeholders who are at the state level, at regional level, and national level. And then lastly, to provide an evidence-based platform to attract multiple research grants on state, regional, and national levels, to provide funding and or logistical support for ophthalmic research projects or research paper presentations at local, continental, or international conferences. So by and large, it's a network that brings together practitioners at different levels in eye care. We have registrars, we have senior registrars, we have fellows, we have consultants, we have very senior consultants in ophthalmology. We also have registrars in other disciplines. I think we have in radiology, we have in internal medicine, we have in public health. So these members are associate members. They bring on board a collection of core values that will add and greatly improve the outcome for the network. Then we have a structure. We have a structure. So let me just outline our structure. So currently, if you go to our website at www.nisanetwork.com/structure, you see the structure that we have. We have the national coordinator, which I'm currently occupying the position. Then we have the national secretary. We have 3 directorates. We have the Directorate of Research and Collaborations. We have the Directorate of Collaborations and Partnerships. And then we have the Directorate of Finance, Grants, and Compliance. And then we also have regional coordinators. Nigeria has 6 geopolitical zones, so we have regional coordinators. So our structure is at the national level, at the regional level, and at the state level. Currently, we have developed the national level structure. we are almost done with developing the regional level structure. So at the regions, so we'll have a mirror of what we have in the national, because we want the regions to be strong. And then also in the states, we also have some mirror of what you have in the regions in the states. So what we want to do is to provide a platform for members to leverage on collective intelligence. Currently, we are working on 5 research projects. We set targets for ourselves on how many qualitative, representative eye research that we will do on a yearly basis. So look out for more of our output. So because of time, I'm going to cut short this introduction and invite Dr. Rohan from OUI to make his presentation on collaborative research in ophthalmology, the experience of OUI. So as he's trying to come on board, I'll just make a quick introduction on the OUI. So the OUI is one of the firms that the network is currently collaborating with. We are collaborating with them on a smartphone slit lamp device. So we are trying to do some series of studies, and when the results come out, we're also going to make us to be aware of it. So I'd like to introduce Dr. Rohan to make his presentation. Thank you very much.
Oh, hello, everybody. Thank you very much for allowing me to be part of this meeting. It is truly an honor to be associated with groups such as yours. If you allow me to share my screen, please let me know when you can see it. Are you able to see it?
Yes, you can see it.
Yes, okay, thank you. So I'll just do a quick overview of our activities. So we Inc., our mission is to reduce worldwide blindness by half and save people's health in that way. We have our company is founded by Dr. Eisuke Shimizu, who's part of this call as well. And he's an ophthalmologist from Keio University School of Medicine. And it's one of the top private universities in Japan, and one of the hardest medical schools to get into. And he himself was in some surgery camps in Vietnam, and he saw that there was a need for a quick diagnostic tool. And that's where he came up with the idea. And we have 3 big departments, the business department, the medical department, and the engineering department. The business department is led by Mr. Shintaro. Unfortunately, he's not with us today because he has a very early appointment tomorrow morning. The medical side is led by Dr. Eisuke, and I'm also part of it. And the engineering team is probably our biggest team. So, what problems are there, and what is the solution that we offer, right? So we all know that blindness and visual impairment cause a huge effect on people's quality of life. And also, as a very negative bonus, they result in massive economic losses. The issue is that so much of visual impairment and blindness is curable. It's preventable. At least it's preventable, if not curable. And it is not prevented because they reside in marginalized areas where access to eye care is difficult. And that's why we focus on South Asia and Africa. So what is the device? How does it help? So essentially, it is a smartphone-based diagnostic tool, and it can work as a slit lamp microscope. We also have other models of fundus camera and indirect fundus camera. And we have a dedicated application. We have a software system for the phone and the web. And through that, we can store the data in case something happens to the device itself. And we can also perform telemedicine, which is of great benefit. And the beauty of it is that the device leverages the light source and the camera of the phone. It does not require anything external. No external batteries, no cords. And also we have an AI system being built. So as I mentioned, we have 3 models. We're focused on primarily this one, the slit lamp. Oh, sorry, just a second. Yeah, so we're focused on this, the slit lamp one. And yeah, this is it. This attachment goes over an iPhone, and through the imaging application that we have, you'll see something like this. And this insurance point thing, it's just, for the Japanese government health insurance system. It's not applicable here. So what are the features? First of all, it's not, it doesn't just have one mode. We have 3 modes. So of course we have the regular slit lamp. We also have blue light, right? And we also have, of course, white diffuse light. And what are the benefits? Well, other than the price, which is irrelevant because we will be giving you one device for free, it is significantly smaller and portable, So if you have patients who cannot move for whatever reason, this is a great tool. And if you are doing something which is very far away and you cannot carry the big slit lamp microscope, this is also a great option. Once we take the video, they are uploaded to the cloud, and then remote diagnosis can happen through telemedicine. For example, even in Japan, my colleagues and we will go to rural areas, and although we know a lot about eyes and ophthalmology, we're still not specialists. So we will take these videos and we will ask Dr. Eisuke, our CEO and chief ophthalmologist, to take a look at it. And when he tells us, we also have a chat function for each video with history that is saved. And right now, we're also building an AI system. So we already have one for cataract. It can grade cataract. We also have one which measures anterior chamber depth. So, one of our major goals is to enhance eye care in marginalized areas, especially in rural areas. And normally there is a big gap between the resources of the city and the needs of the rural areas. With the SEC, we aim to bridge that gap because of our telemedicine function, with our AI system, and of course, simply the portability, right? Even if for some reason you cannot do telemedicine, maybe you have internet issues, who knows, it happens. You can still record all the data, take it back to the city really quick, and have a doctor look through it. And we really pride ourselves on being on practicing evidence-based medicine. And in Japan, we have many papers published with the Japanese population. We also have some with the Italian, Indian, and Indonesian population. We would also love to have you work with us and make publications together. These are the countries and areas of the world where the registration of the device is completed. And so one of the long-term goals of We Inc., of our firm, is to do a lot of research in Nigeria and use that as a base to be able to perform registration in the future. Of course, we're not in a rush right now. We're not at that stage. And right now we are present in over 60 countries, and over 150 devices are in use worldwide. And either they were sold, they were given for research, or sometimes even charity. Oh, sorry. Yeah. And the grants we have received so far, I know some of the names are in Japanese. I've done my best to translate it. And these are also some of the awards we have received. And that's my summary. So if you have any questions, please let me know. Yep. Okay.
Thank you so much. Yeah,
Thank you.
for a beautiful presentation that you made.
Thank you as well.
Okay, let me just tell the story of how
please
of how I came to know about OUI.
Mm.
I usually have the habit of searching for cutting edge new technologies that are available across the world. So if you go to the IAPB website, the International Agency for Prevention of Blindness, OUI is actually one of the firms that was listed as a partner technology firm for prevention of eye diseases. So I reached out to OUI, we had some discussions, and we started thinking of how we can collaborate and have research done for the Nigerian population. I believe that you have a lot of experience in other African countries like Kenya, Malawi, Mozambique, North Africa. So we actually want to do extensive studies for OUI, and it will be a mutually beneficial relationship. That's the beauty of collaboration. Thank you very much. Before I open the floor for questions, because we have just like 5 minutes for questions, I want to especially welcome Professor Upola. Please, please, can you just say hi to the house before we continue as a senior advisor to the network? Thank you, ma.
Okay, good evening, everyone. Well done for all you are doing. So I'm interested in listening to you. Thank you very much for inviting us. Thank you.
Thank you. Thank you very much, ma. All right. So do we have questions? If you have questions for this presentation, please indicate by raising your hand. OUI is a device that can convert a smartphone to a slit lamp biomicroscope to image the anterior segments of the eye. They also have other adapters which they are currently working on, but the one that we are collaborating with them currently is on the slit lamp adapter. So I'm going to share a link to all the evidence concerning the device. Or Dr. Rohan, if you can also share it, I will appreciate it. So while you are doing that, I would like to invite Dr. Chidi Mbakigwe to ask a question. Go ahead, sir.
Okay, mine is really very simple. I wanted to know from him where they are with something that can image the posterior segment. Thank you.
Yeah, thank you very much for your question. So as I mentioned, we do have two other models. One is it acts as a direct ophthalmoscope, and another one acts as an indirect ophthalmoscope. But one of them is still under development, and it's just a prototype, and that's the indirect one. And the direct one, although it is developed, it is only right now legally open, for use in Japan. We're still working on legalities.
All right, thank you very much for that. We have 3 more questions in the order. Dr. Dili Chuku, please, you have 30 seconds for your question, and we'll take the next question. Go ahead, ma'am.
All right. Thank you very much for your presentation, Dr. Rohan.
Thank you.
My question, since you've worked in some African countries, what were your challenges implementing use of that device in those countries?
Oh,
Also,
yeah.
Also, secondly, where is your data stored? Because I know you'll have probably a cloud where you store the data. And do you have challenges with getting data protection from countries where you've worked in? Thank you.
Thank you. Thank you very much. All those questions are very valid. So first of all, where it is stored on our server. It is based in Japan. It's an Amazon Web Service server. Yeah, and in regards to data the rules, it depends country to country. We see how it is. In Nigeria, from our previous experience, this is before I joined the firm. I haven't heard of any issues. And in terms of challenges that we have experienced in other African countries, so it differs. It depends which country, of course. Sometimes it's as basic as people not being used to using iPhones, because this device is compatible. The attachment is compatible with certain types of iPhones only. So that can pose an issue, because if somebody has never used an iPhone, then it is a very steep learning curve. So that's one. The other one, of course, is theft. We have faced that before as well. And lastly, the biggest one I would say is internet. Because to keep the data secure, we do like to store it on the cloud, not just for telemedicine functions, but just so that we don't lose it. And a lot of times, access to internet is severely limited. Yeah. And also, although we don't require any external batteries, the phone does need to be charged. So if electricity is gone for a lot of hours and you're using it for 5, 6, and maybe if it's a newer version, 8 hours, beyond that, it does require charging. So I hope that answers your question.
Yeah.
All right. Thank you.
Thank you very much.
You're welcome.
Because of time, we'll take just these 2 questions. Ibitola Makanjola, you have 30 seconds. Then after you, Ibrahim Uma. Go ahead, Dr. Ibitola.
Okay. Yeah, thank you. I would like to know if the device is able to view the angle. Since it's attached to slit lamp, can it be used probably when you're doing gonio and you can actually be able to capture the angle with it?
Yeah, gonio, it's tough. It's I wouldn't recommend it. No, sorry. Yeah.
But you can, yeah, just to add that answer, you can see the lower part of the angle or the superior part of the angle, because a slit beam is a fixed angle, so that you can estimate the anterior chamber depth, and you can estimate the angle of the inferior part.
Okay, thank you.
All right, thank you very much for that. Yeah. Ibrahim,
thank you. Good evening.
Umar, yeah, go ahead.
Yeah, good evening, everyone. Mine is a very simple question. Just the meaning of OUI is what I want to know. Thank you.
Thank you. So OUI is, French for yes, right? Oui. So OUI, and then after that ink, together it becomes we ink. So little wink. That's it.
Yeah. Yeah.
That's a good question.
All right. Yes, it's a very good question. So we are collaborating with OUI as a network. We are doing some pilot studies, and hopefully we are going to be having results soon. All right, thank you very much for that. So Rohan, if you want to continue staying, we'll be glad to have you. I know that it's about actually, 1 a.m. in Japan.
I mean, it's okay at this point, but actually I wanted to ask if I could quickly just 10 seconds just show you how it might look like when we use it.
Okay, please go ahead. Go ahead.
Yeah. So just a second. Okay, so so this is the attachment, right? It goes over an iPhone like this, right? Simple. And let's break it down. So just by itself like this, we will get, as you can see, there is a lens, and then there is a hole. So the lens goes over the camera, and the hole will go over the flashlight. This is how we leverage the camera and the flashlight of the phone. Just by using this, we will get white diffused light. Now, the light that's coming out of the hole, we can put a blue light filter over it like this. Yeah. And Of course, we can put a slit over it like this as well. So that's essentially how it works. And we have a dedicated imaging app, as I've mentioned before, which might be too much of detail for today's meeting, but at least let me show you how it would look like on the screen. So I have the slit mode on right now, as you can see. So this is iPhone with the light, and then I put this. Now it's a slit, like this. And this is my eye, real time. Yeah. So essentially, that's how it would work. I just wanted you to have a quick snapshot in your head of how it would look like. Thank you very much.
Yeah, thank you so much. The Japanese, you are usually at the cutting edge of technology. So we are very much impressed by what you are able to achieve. So because of time, so we are going to quickly go to the next presentation, which is by Dr.
I think somebody had a question.
Okay.
Somebody raised their hand. Yeah, Dr. Christine.
Okay, Dr. Christiana. Okay, please, Christiana, you have 10 seconds.
Okay, thank you for this lecture. I want to know if it's affordable. And then you were mentioning about putting it on a street lamp, but what you just did now, it does not require a street lamp, right?
Oh no, the whole, this is the set with the attachment, man. This is the whole set. So this itself, this is the slit that we keep there.
Okay.
Yeah. And this is the blue light filter. I just keep it in the back for stability. It's not functional right now. This is in this mode. This is the slit light microscope. It turns into a slit light microscope.
Okay.
Mm-hmm.
Okay.
Yeah.
I get
Yeah.
that.
This is the attachment. Yeah. Can you snap alongside as you view the eye? Dr. Boma, thank you very much for the question. We take videos. We take videos and we store them. And if you want, you can take a screenshot of the best frame of the video. Why we don't take an image is because we have a lot of non-eye professionals who use our device, because especially in developed countries, they have the devices. Who don't are the GPs, the nurses, medical students, so professionals of that nature. So if they take a picture, that slight movement, it distorts the picture, like in that moment when they press it, when they click the picture. So that's why we take a video. It gives a more stable view. Thank you for your question as well.
Thank you very much. I have some experience in that. In imaging the posterior segment, it's usually better taking videos and can now get a frame from the videos, because some videos, if it's taken at 30 frames per second, you can have up to 30 frames in 1 second. So if you missed anything at the first frame, second frame, you can actually get it at the 25th frame. Then if you are now doing it at a higher frame per second, like 60 frames per second, you now have 60 frames in 1 second. So
exactly,
just to add a point to that. Thank you very much for your presentation.
Thank you.
If you can, please continue to join us. So I want to invite Dr. Ugochukwu Eze. He's currently the director of collaborations and partnerships. He's a consultant in Federal Medical Center, Asaba. So, sir, please, you have the floor. He's going to present from COVID isolation to book and journal publications, and author story, the place of collaboration. So, Dr. Eze Ugochukwu, please, you have the floor for your presentation. Thank you. Dr. Eze. Dr. Ugochukwu Eze, are you with us? Okay, seems to be having challenges. Okay, I will try to reach out to him. I'll try to reach out to him. Okay, he's about to start. All right. Okay.
Am I audible?
Your voice is a bit low. Can you speak up? Okay, while we wait for him to sort out his audio and start the presentation. So in our network, we have associate members. One of the things that helped form this network was the experience that we had when we were in training. The Nigerian Association of Resident Doctors, NAT, has a research collaboration where all the centers across the 36 states of Nigeria collaborates in doing specific studies. So I now said, okay, if we can do studies on early career doctors, why can't we also do similar studies on ophthalmology? So that was how the idea started, and we are currently at this point. All right. Okay. Dr. Gochuku, please, have you started your audio out?
Yeah.
Okay. Yeah, I think you may need to mute one. There's two devices bearing your name are on, so maybe you can mute one so that will not have echo. Okay. While we are trying to do that, Dr. Mbakigwe asked, can you tell us the particular iPhone that works best with the device? I think it's iPhone 8, right?
iPhone 7 and 8 from the older models, and from the newer ones, the SE2 and SE3.
Okay. All right.
Thank you.
Okay. Thank you. Yeah, but it's still low. If you are using an earpiece, maybe you can change it. Your voice is low, sir.
I'll try to be louder.
Okay, go ahead.
But is my screen sharing? I don't think it's sharing.
Yeah, I think you need to share your entire screen, not just the PowerPoint. You can share your entire screen. We are just seeing a frozen screen. Yes, sir. Or if you are having challenges sharing it, maybe I could do that from my own end. Okay, if you are still having challenges, I will download your presentation and I'll present it. So you will just be speaking. It may also help you to reduce the bandwidth. Okay, so I've downloaded your presentation. So I'm going to take over the sharing now. Just a minute. So I'm going to open the presentation now. Okay, so I've downloaded the presentation. So I'm sharing my screen now. Can you see my screen? Can you see my screen?
Yes.
Okay. Dr. Eze, please go ahead with your presentation. Wow, sorry. Dr. Eze? Can you unmute yourself and speak?
Thank you. Thank you, esteemed colleagues and seniors. Good evening for having me. Thank you for having me today. My topic is simple. I've been asked to share my experience on how a team we formed was able to transit from COVID isolation to book and journal publication. Then I'll highlight the place of research collaboration. Am I audible?
Your voice is low. Your voice is low.
So I'll highlight the place of research collaboration. Is it better now?
Yeah, it's having echo. You have two devices on.
How about now?
Can you disconnect the device that you are using to make presentation, since I'm already doing that? Is it possible? Okay. You have two devices that are on. Okay, so while we wait for Dr. Oguchukwu Eze to come on, so maybe we'll just take more introductions that we didn't take in the beginning. Dr. Linda, do you know where you stopped? Okay, so let's just do it this way. If you are here to introduce yourself, you could raise your hand and then we could do an order from there. So just raise your hand if you are here to introduce yourself. Okay, Dr. Susanna, please go ahead. You have 10 seconds.
I am Dr. Adepoju Susan from Lauter Teaching Hospital, Ogbomoso, also lecturing at the Ladwika Akutela University of Technology as an ophthalmologist, a member of NISA. Thank you.
All right. Thank you very much. I like how you say the member of NISA. All right. Please, more introductions, please. If you are here to introduce yourself, please go ahead. All right. Just go ahead and raise your hand and then introduce yourself. Yeah.
I'm Dr. Ibitola Inesi. I'm an ophthalmologist at Federal Teaching Hospital, Lokoja.
Yeah. You're welcome, ma. Okay. Dr. Cyril, we have not heard from you, sir. Dr. Cyril Obasuyi is the Director of Research and Collaborations. Please go ahead.
Good evening, everybody. Thank you for having me on board. I'm Cyril Obasuyi, Director of Research Publications, NISA Network, ophthalmologist at the ERA Hospital.
All right, thank you very much. I would like to especially recognize the presence of Dr. Edak Ezanosike. She is a consultant ophthalmologist and an oculoplasty consultant in Alex Ekweme University Teaching Hospital. Please, ma, can just greet us or say one or two words. Okay, all right. Dr. Gochukwu Eze, are you ready with your presentation?
I'm ready. You have it. Good evening, everyone. Greetings from Abakaliki.
Thank you very much, ma. We are glad to have you on board. All right, Dr. Eze, please go ahead.
Yeah,
I'll be moving the
fine.
slides for you.
Yeah, that's good. Thank you very much. Sorry for the hitches.
All right, you can start, sir.
Yeah, fine. Thank you. Good evening, everyone. Thank you for having me. Once more, I apologize for the hitches. The title of the topic for today is From COVID Isolation to Book and Journal Publication. And I will highlight the place of collaboration, as I was asked to do. Like I said, next slide, please. So like I said, the national coordinator has asked me to share experience the process that led to the publication of this book and a few other publications that were all conceived at about the same time. The title of the book. The book took us 4 years from conception to when we eventually published it in May 2024. While the book was conceived, we had other things that we had in mind. We conceived, and we can see them on the next slide, a few of them on the next slide. Next, some of the authors of these works are members of this publication. Some of them are also on this call. Actually, the book was the first, but these ones came as appendages as we progressed. Next slide, please. I'll do the presentation of this outline in the next 15 slides. I'll tell a brief story about the conception, brief history of COVID, the place of collaboration, and I'll go ahead to conclude. COVID, we all know, was announced in December 2019 to the early January 2020. Came along with a lot of anxiety and confusion. Response of different governments was neither here nor there, caused a lot of apprehension, led to different knee-jerk decisions, some informed, some not well informed. As a whole, there's a lot of confusion around the world during the period. Next slide. So amidst the confusion and all, I needed to see a colleague or review a colleague one day who was a medical officer then where I worked. And eventually she's now a resident. A few days after reviewing her, I was called by the medical director of the hospital where I worked, and I was asked to proceed on a self-isolation, that this colleague and the rest of the family members tested positive to coronavirus, and that I was traced as one of her contacts, and the need for me to present myself for tests and proceed on self-isolation. It was sort of a root shock. Like I said, a lot of confusion. I didn't understand. I lived alone and all. A lot of things happened in my mind. And again, the contemplative me asked a few questions while people were arguing on different clinical manifestations of COVID and all. I took a few notes, did a few Google search, and we decided to come up with a major review article on the clinical manifestations of COVID. Also, the other activities, the other titles I had highlighted before that were published as journal publications. So the book, we intended it to be a journal publication as a major review article, so that anybody who goes to the book, who sees the article, will have everything piecemeal on the different manifestations of COVID. Our search showed us that almost every organ system of the body was actually affected, and each system had a manifestation that could be explained by the disease. And as soon as we took the decision to work on the title, I knew it was difficult to do a good work alone, and we started thinking of the need for a collaboration. Started to plan a team, Next slide. So below, subsequently, what we'll be seeing will be few steps or key steps that we employed or we use in forming our collaboration. First thing we must know that every collaboration needs a leader. That leader needs either to be the initiator of the idea or somebody appointed. If the person is not the initiator of the idea, the person should have understood the vision of the original initiator of the collaboration. Once this is done, the next thing to be done is to come up with the aim, clear aims and clear objective. And again, objective must be SMART. SMART in this term means specific, measurable, achievable, realizable or realistic or realizable, and time bound. We employed some of this in our collaboration. Key steps that we use in this collaboration that, like I said, the main objective we have was to develop, the main objective we have was to develop the main objective we have was to develop a one-stop manuscript that was going to be used for anybody to see the different manifestations of COVID-19. And initially, we wanted a review article. So we formed collaborations of like minds and different subspecialists that were going to contribute in this article as subsections. But eventually, we experienced a number of rejections. And again, a member of this collaboration suggested that we consider a book. And from the challenge of rejections, we now decided to consider a book and opened it up. And each of the subtitles or subsections of the research of the manuscript became a book chapter. And that was how we expanded it and the work proceeded. Next slide, please. Our objectives were supposed to be steps by which we will use to achieve our main aim. And with this, we broke the book into different titles, and we had 19 titles that we covered in the manuscript. Next slide. I think we can, after the next please. I have spoken about complementary team members. For this book, it was my network or our network that we used. Mostly some of these people were my classmates, some contemporaries in the university, my immediate seniors and immediate juniors. Some were my teachers who were residents in the teaching hospital while I trained. A few associates that were interested in this, and a few collaborators from the NAD Research Collaboration Network that Dr. Chima spoke about. So it was just through my network that we're able to get these people. 6 members of this team now formed an in-house group of editors. One of these editors was a teacher, and he was the content editor, and he's an infectious disease physician. And the others were all members of the Research Collaboration Network. One I must highlight was actually an editor of a journal of a medical association journal, who eventually became a copy editor, professional copy editor, and currently doing the work very well. So she built up her interests and her talents and have been working with it over time. Next slide, please. So point number 4, as soon as we had a team, we decided to create a communication channel. So a very important thing in every collaboration is having a communication channel, like we're having now in the NISA network, the different WhatsApp groups we have, different structures we have in NISA, the different groups we have with our advisors, our regular meetings. All these serve as points for meeting where we discuss our targets, distribute tasks, create timelines, and review our activities. Next slide, please. Another important aspect is to have a collaboration agreement. In this collaboration agreement, people decide how the work will proceed. If it's a research work, you decide in terms, maybe some decision have to take like authorship and all. But for this one, we just grouped the collaborators into leaders for the respective chapters and those that will serve as corresponding authors for the respective. We're quite flexible and we worked in mutual understanding, and it worked for us. Our agreements were actually not documented, but there were no issues about this in the collaboration. Next slide, please. Every collaboration must keep in mind that there will be challenges, there could be conflicts. So when planning a collaboration, we need to keep an open mind that we might have difficulties meeting up with timelines, disappointments, uncooperative collaborators, withdrawals. And so the leader of any collaboration should have an open mind, ready to accept disappointment and find a way to move on. In this, one of the chapter contributors, who was one of the first people that started submitting when we started at some point said that should no longer send in messages, that he was not interested in participating and all that. Well, I accepted when he said it, but considering his contribution to the work, I didn't see how I could let go of him. So eventually I decided to modify what he did, got somebody to do some of the tasks we asked him to do, which he eventually refused to do, found a way subsequently before publication to bring him back on board, and he still eventually was part of the publication. So I didn't drop him as he requested. Again, there are some people that decided at some point not to contribute at all. That's why I find that they agreed to join the collaboration. Some other people just decided not to contribute at all for whatever reason. Some decided different things. So there are actually some, after we decided to make it a book, they refused to do the work the editors asked them to do in terms of expanding the document. So we found different ways around it. So the approach of the leader will determine the outcome of the success of any collaboration. Thank you. Next slide, please. Another important thing every collaboration should consider doing, which I think we're already doing in the NISA network, is to celebrate milestones. We utilize this as a step to celebrate different milestones. Such milestones include completion of tasks. Especially, we had contributors that went down with COVID while we were doing this work. And with their permission, when they recovered and resumed work, we announced to the group and people welcomed them back and people encouraged them while they were submitting. Some of them even did better work in terms of respecting timelines than people that never went down. Other things that milestones we had was the choice of a publishing house, which was quite a challenge for us, but eventually the choice of publishing house was something we celebrated. The final submission of the manuscript at different points, from before peer review and after peer review, when we shared it in the group, people used it to encourage ourselves, and we had hope over time. Important announcements from the publishers too were celebrated, and we used it to encourage ourselves. Acceptance of the manuscript was announced in the house using the communication channel, and we used it to celebrate ourselves. Then the final publication, which was what we expected for the 3.5 years 3 years after we decided to make it a book. Next slide, please. Periodic evaluation and appraisal. So for every collaboration, there is need for an in-house evaluation. We need to do this at interval. For that, to know that this is not a fault-finding exercise. We usually need some of these things to ensure that we are working in line with our objectives and we are going to meet timelines. Sometimes we will not meet timelines, but when we find some of these things, we take it as lessons, put some of these things behind us, and move on. Usually a very frank in-house audit to foster accountability and use of time in collaboration. Another important point is effective dissemination. Very important. It is pointless actually going to a research collaboration or engaging in a research collaboration without any concrete plan of disseminating it. Research is not for the folder, not for the shelf, but for the target audience. So different forms of dissemination include publishing in journals, publishing in, submitting it as policy documents, presenting at different meetings and conferences, sharing with stakeholders. And this step could be very challenging because different people in collaboration may have different opinions about the style of presentation, but it's another thing that can be overcome with good communication. Lastly, learning points. Every research collaboration or engagement is a learning opportunity. We can learn from all the steps listed above. We actually had a lot to learn from. Every challenge we experience in the collaboration is a point to learn. There's always a lesson to learn from collaboration, to learn from gains, high points, low points, and challenges. And the review and evaluations meetings are important teachable moments in collaboration meetings. In conclusion, every collaboration needs a leader, needs a clear objective, a complementary team, and a good communication channel. Team members of every collaboration should be open to the possibility of conflict and challenges. When they arise, it's important to face them on their merit. Sticking to the rules of engagement of a collaboration is one way of preventing conflicts. Thank you for listening.
Thank you so much, Dr. Ugochukwu Eze, for a wonderful presentation. So we have heard his presentation and experiences on how they converted manuscripts that were rejected into a book that has been published. Dr. Ugochukwu, while we are taking an order for questions, maybe you can send a link to the book so that those that are here can actually download it and read it. A chapter is on ophthalmology, that's the eye presentations of COVID, while other chapters are under systems. All right, so if you have questions for Dr. Ugochukwu Eze, please, you can raise your hand and you'll be given the floor. While we are doing that, I would like to especially recognize the presence of Dr. Chinanwa. Is someone that I hold highly and dearly. I did training under him in a high volume center at ABAC in Akwa Ibom. So Dr. Chinanwa, while we're waiting for the questions to come, please, you have the floor to quickly make one or two remarks. Thank you, sir.
Hello, thank you very much, Dr. Doga.
Thank you, sir.
Can you hear me?
We can hear you, sir.
Okay, I'm sincerely sorry I joined in late, but I am very impressed with what I'm seeing here. Sincerely impressed. The future of the practice is more about collaboration, not just collaboration in skills, but collaboration in knowledge and ideas. Medicine is just an aspect of life. We can collaborate in medicine, we can collaborate in finance, we can collaborate in everything, not just as it has to do with medicine. So I will implore every one of us, as we see the days approaching, collaborate medically with colleagues, collaborate with like minds that are not medics, because there's so much to learn beyond the spheres of medicine. And when you talk about fulfillment in life, it's not just about career success. And also the young man that presented, from COVID to journal and book writing, it was quite impressive. It was like a period that the world felt they were disadvantaged and people were making invention. Unfortunately, I missed the first presentation. I don't know if there will be any record or we can refer to that. So Dr. Doga and your team, I'm quite impressed. And then for the older ones, I can see Dr. Edak there. I was impressed when I saw her. So kudos. You are on the right track.
Thank you. Thank you very much. Yes, the recording is going to be made available to each and every one of us, and it will be on our website. And we have quite a number of senior members online. We have Professor Dube Ademola Popola. We have Professor Adebayo Adio. We have Professor Onochie Okoye. We had at a point Dr. Ezisi. We had we have Dr. Ogugwa Okonkwo, and we have given them the floor to introduce themselves. So as they come, we give them that floor to introduce themselves. So thank you very much for your contributions. Then we have Dr. Nkiru Kalkolago, who is my head of department. Thank you very much.
Thank you.
All right, thank you. Okay, so do you have questions for Dr. Oguchukwu Eze before we go to the last item in our agenda, which is remarks by our senior advisors? Any questions for Dr. Oguchukwu Eze? Okay, Dr. Oguchukwu Eze has posted the link to the book, so we can click on the link and download the book and see the details. Okay, Dr. Oguchukwu, please, you have your hands are up. You have the floor.
Okay, I saw one question, how we decided who was going to be first author. Well, it was a gentleman agreement. There was no special, the main thing was that whoever was going to be a first author in any chapter was going to be a specialist in that chapter, willing to work. Then somehow, it was a natural selection. Some people showed enthusiasm, some people did not. So naturally, some natural selection came to play and it sorted itself out. It was not a big issue at all. But the link I shared is just an outline of the book. It shows the whole book abstract. You will not be able to get the full book because the book is actually on sale online. However, if you need the book, you could contact me privately. I can make it available to you. I have the PDF copy. But the book is actually on sale online.
All right. Thank you very much, Dr. Gochukwu, for that information. Okay, if we are waiting for other questions and because of time, I would like to invite our senior advisors to make some comments because these people are highly respected, established, renowned ophthalmologists in Nigeria who are senior advisors to the network to ensure that the network is properly guided. So in no particular order, if any of them wants to make any remark, please, they can feel free to go ahead. The floor is open. Thank you. So, yeah. Professor Adio, please, do you have any words for us? Any parting words for us?
Yes, it's my pleasure to be part of this huge effort. And we know that in any new effort, we need to establish teamwork. We need to work together to complete this shared goal. And what we need to do now is to ensure that all the individual efforts of everyone goes towards achieving the goal as smoothly as possible. So I wish us all the very best. And I believe that as each project comes in, we will complete it collectively and everyone would be happy at the end result. And I believe that this will go beyond the shores of just Nigeria. It's going to be a global effort, the way it is going. So I believe all the building blocks have been laid in place. And as we build on it, I believe that everyone that needs to benefit from this is going to benefit, especially the people that we are working and ensuring that their vision is kept alive. Congratulations, Dr. Chima Edoga and team.
Thank you so much, Prof. We are glad to have you as a senior advisor to the NISA network. I would like to invite Professor Dube Kupola, who I take as my own mother, to please make some few words.
Well, thank you, Dr. Chima Adoga. I acknowledge the colleagues and senior colleagues here. And like I said before, congratulations. It's not easy to collaborate, to work with people. I have listened in all through since I joined, and I'm happy. And I'm happy at the presentation of the book, how it went about. It doesn't always work out that smoothly. On a general note, I would say that people should know that there's something called scholarship, and it's a matter of a lot of integrity. Everyone should be planning to contribute to the group, not just to be added on to things in which you do not contribute to. In other words, if you have an idea, like he mentioned, you will lead that idea through. But if you don't think about contributing to the group, even what you know, you won't bring on board. So I want to encourage all of you. Everyone should strive to bring, and I pray that the leaders will continue to have a large enough room to accommodate everyone. Well done.
Thank you so much, Ma. Thank you, Ma. I would like to invite Professor Olushola Olawoye. She is the secretary of OSN. She has been of tremendous support to this network. Ma, please, you have the floor.
Well done, team. Well done, Dr. Chima. And I am very impressed by what is happening. Congratulations to everyone. And I wish us the very best. You know, like Professor Kupola has mentioned, there's something about scholarly input. This is important, and we all must contribute to the pool. I'm very impressed, like I said, really, really impressed by this. We'll continue to work hard. We'll continue to help in guiding and, you know, supporting the team and the collaborative efforts. And so we congratulate everyone. Thank you very much, and thank you for inviting us. Thank you.
Thank you so much, Ma, for your support. Dr. Nkiru Kakolago, who is my own head of department, please, you have the floor, Ma.
I must say a big congratulations to this.
Ma, your audio is low, Ma. We want to hear you.
Okay. Can you hear me now?
Ma, are you using an earphone?
No. Can you hear me?
Yes, it's better now, Ma. It's better now, Ma.
Okay. I say congratulations to our team. And in a special way, Dr. Dog, I want to congratulate you. You know, one of the senior advisors mentioned something at the beginning, that to start something is not the problem. It's easy to start something, but sustainability. And that's one thing I want us to focus on, you know. So please, let's make sure that this good thing we've started will be sustained. I want to congratulate all of us. I actually enjoyed this meeting, and I also want to thank the presenter, the book presenter, Dr. Eze. Well done, eh? Thank you all.
Thank you so much, Ma, for the support. The current address of the NISA network is actually the Ophthalmology and Research Center at Department of Ophthalmology, Esut Park Lane, and the head of department has given us that privilege to use it as a base center for us to work on. So I appreciate you, Ma. All right. Do we have questions for Dr. Ogochukwu Eze before we bring this meeting to a close? We are going to make the last round of introductions for those that have not yet introduced themselves. We want to hear from everyone and know where you are currently based, because this network, as much as possible, we want to have people from every part of Nigeria. And we are also beginning to build our African network. We have someone in Liberia. We hope to have collaborations outside Nigeria and then outside Africa. So it's supposed to be a very significant network that will help provide a platform for different kinds of eye research. And I also want to, at this point, say that our senior advisors, apart from advising us, if they have research projects that are dear to them, the research network can also work along with them to implement those researches. And more details will be posted on our website. So please, if you have questions, you can go ahead to raise your hand. But before we do that, if you are here to introduce yourself, please raise your hand and you have the floor. This meeting will be ending in a few minutes' time. If not, I'll be calling people by name. All right, Dr. Annie Bernard, please go ahead. Dr. Annie Bernard, you have the floor. Okay. Dr. Annie Bernard seems to be having issues with his network. Dr. Tongriang Ben Ame. Dr. Tongriang Ben Ame is the Director of Finance, Grants, and Compliance. Please, you can introduce yourself now.
Thank you very much. I think I've been introduced already. That's my name, Toriang Bename, a member of the NISA network and Director of Finance, Grants, and Compliance, and an ophthalmologist with Benue State University Teaching Hospital. It's been an enlightening session, and I'm glad I did not miss any part of it. Thank you very much.
Thank you very much, ma'am. Okay, while we are waiting for other people to raise their hands, I would like to invite Dr. Chidi Mbakigwe, who is someone that is very dear to me, a medical retina specialist, and one of my supervisors for my part 2 dissertation. Sir, please, you have the floor. Dr. Mbakigwe, sir.
Yes, I'm here. Okay, thank you very much, every team, especially and your team that put together this wonderful initiative. But it cannot be overemphasized that, like Dr. Kongo says, starting things is easy in parentheses. There's a lot of energy in the beginning, enthusiasm, but sustaining it is where the work is. So I want to urge all of us to, against all odds, in spite of inconveniences it will cause in the future, to hold forth so that this light, this candle we lit today or in the recent past will not go off. I wish you all the best. This is very good news. Thank you.
Thank you so much, sir. Thank you very much. We really appreciate it. Dr. Eda Kezanosike, please, you have the floor, ma'am.
Well, good evening, everyone, and thank you so much for the kind words our very senior colleagues and professors have shared. I want to appreciate and honor our chiefs who have literally laid down their lives to build this profession in this country and to train the next generation to where we are at today. And we pray that we ourselves, as we grow, will not fail them and the hopes that they had in driving the development of research in ophthalmology and all other subspecialties as we work together. I want to commend again Dr. Chimaya Duga for his doggedness and commitment to this service. Everyone whose hands are on deck, please don't look back. Let's be sure that the goals of this collaboration are achieved, and in years to come, we'll all be proud to be associated with this work. Thank you very much. I really am glad to have been a part of this meeting. God bless you.
Thank you so much, ma. It's an honor to have you. Please, Dr. Gloria Eze, please kindly introduce yourself. And then if you have not yet done so, please raise your hand before we bring this meeting to a close. Thank you.
Good evening, everyone.
Good evening, ma.
I'm Dr. Gloria Eze, consultant ophthalmologist at Institute Teaching Hospital, Parkland. I'm also a member of NISA Network. Thank you.
Thank you, ma. Thank you, ma. All right. Because we don't have any other hands up, Dr. Onyinye, you came in and left at a point. Please, you have the floor. And then Dr. Shahi Umabelo can also introduce yourself quickly before we end this meeting. Okay. In the absence of any other hands for
Hello,
introduction.
everyone. Good evening.
Okay. Good evening. Go ahead, ma.
My name is Dr. Onya Onyinye, consultant ophthalmologist and cornea specialist at Federal University Teaching Hospital, Owerri. And I'm also a member of NISA, and I'm glad to be here. Thank you.
Thank you so much. Thank you so much, ma. Any other person to introduce before we bring this meeting to a close? Any other person, because I don't want to miss out anyone. It's a collaborative effort. Everybody is important to the network, so nobody is overlooked. All right, so in the absence of that, I would like to officially say that the NISA network has come to stay, and we have a lot of projects that we are working on. But currently, we are focused on training to build the capacity of the members of the network and also to build the membership of the network. We are currently trying to reach out to different scholars, different persons, so that we can have a wide national coverage, because the work that we want to do, we want to have representative data for anything that has to do with eye. And we are not going to be working against any group, because we know that there are groups that have already been existing before now. So what we want to do is we want to have a platform that can actually complement and supplement the roles and the efforts some of the other groups are making. So we are open to research, and hopefully we are also going to apply and obtain grants to do more research and have publications at different kinds of journals, both local and international, and also have conferences to present our work both in local and international. So on that note, I would like to appreciate everyone who has brought out time to join us in this meeting. This meeting is going to be brought to a close, but before we do that, I'm going to stop the recording, and those that are online can exchange complimentaries. Thank you very much.
Yeah, thank you. Thank you, everybody.
Oh, Dr. Rohan, you are still with us.
Yeah, I'm here. Yeah.
We are very grateful. Yeah.
Yeah.